I first of all want to thank everybody who is participating, able to attend. And if you're not actually here live and you're hearing it as a recording, I hope this will be informative for you. I also have one of my good friends, Cecilia Harris of Harris Resources. She will be assisting us later to answer some of the questions that may come up from our audience, and just really excited to be here. So thank you again for being for everyone that is participating. So let's talk about what we are. Geez, can you believe it's November 14th, and that means that we're smack dab in the middle of our open enrollment for the country. So let's talk about that, because there's a lot of questions we're getting. You know, we had our first session in October, and we had great outreach from ASID members reaching to us to say we'd like to learn a lot more about enhanced care, but also learn more about what's going on in the marketplace, and to learn how things are working. So let's talk about what we're going to discuss today. It's going to be about 20 minutes, and then we're going to open it up for discussions, and if we'll add some nuances that are happening, because honestly, the world of healthcare is changing every day. So our agenda, we're going to talk about the updates for the healthcare marketplaces. We're going to introduce enhanced care for the ones that don't know who we are and what we do, and talk about what those services could help you. But really what we want to do is share with you some insights on what's happening. So a lot of people have been asking us questions. Is there still, what are the important dates for enrolling for health insurance for open enrollment this year? So we're going to address those questions. Are we still required to get health insurance? Because we're all a little confused, right? Is the Affordable Care Act still in play? It sounds like it's not, or is it? Do we still have to get coverage? Do we still get penalties? We're going to address those questions. And I'll share with you a lot of our questions that are coming through to our website and to our team is what are my options? Because I'm a small business owner and I have some staff, or I have myself and a colleague. Should we be buying individual plans, or can I buy group plan for health insurance? And so those seem to be the most common questions, and we want to address all of those. So let me first give you an update on the Affordable Care Act. So this is the word. The Affordable Care Act and open enrollment for this year started just on November 1st, so 14 days ago, and it's going to go through December 15th for the healthcare.gov states, and there are 38 states that use the healthcare.gov website to purchase individual health insurance. What we're anticipating, or what we're seeing, is there's an average premium increase for individual plans to about 12%. So it's not crazy, because last year we had some really crazy increases. Now, 12% is still high, and whenever there's an increase, it's not comfortable, right? But supposedly the subsidies, if there are any government subsidies still, and it seems like there will be, they also match to those potential premium increases. So hopefully that won't impact you. But certainly there are certain states that had higher increases than others. Let me explain the difference. So healthcare.gov is obviously a federal website for 38 states, and you have 45 days to enroll. You have from November 1st through December 15th to select a plan for yourself or your family, and then the effective date is January 1st. So the beauty of that is that you should be able to shop, figure out which plans make the most sense for you, select the plans, and be able to get health care starting the first of the year. For those people who've had health insurance plans through the marketplace, you will either get an email, a communication to you saying, hey, you can renew if your plan still exists, and that will make things much easier. Or you could say, you know what, if you wanted to change your plan, rethink your strategy about how you pick health insurance, then you can make a change during this period of time. So think of it that way. Now, there's 12 other states that don't use healthcare.gov, and they use their own state-run exchange, meaning their own marketplaces. And so they have still the healthcare.gov related insurance plans, but they have some other options that might be beneficial to you. Many of you know, I'll mention California, New York, Maryland, Massachusetts. Those all have their own state exchange plans or programs, and they have a little bit different for open enrollment. So specifically for where you live, you should do some homework and make sure that the enrollment dates are what that fall. They're at least going to be from November 1st to December 15th. They're not going to be shorter, but they may be a little bit more extended. Like I know for a fact New York's extended a bit. So just make sure you understand that. To share, is the Affordable Care Act still in effect? It is still a law, and therefore it's still in effect. And that means that you are required to get health insurance as well. If you don't, obviously there's the possibility for tax penalties. Now, we're in the system. We get a lot of updates, and we're hearing that the IRS for corporations that are considered large, that means over 50 full-time employees or full-time equivalents, they are getting notifications from the IRS from 2015 right now. So isn't that crazy? It's 2017, but the IRS is finally now communicating to those companies that did not offer a solution, affordable healthcare solutions to their employees with notifications back till 2015. So what that tells me, and should tell you as well, if you fell into that over 50 full-time equivalents, you're probably going to, and you didn't have health plans for your staff, you're going to be starting to receive IRS notifications about the penalties and so on. But what we say here is, we want to help you, and that's why ASID and Enhanced Care and the Insurance Exchange have all worked together to try to come up with some options for you. So let's talk about what would be the best plans for you. Let's start targeting, and our recommendation is this. There are still plans being added every day to the marketplace. It sounds crazy, like why didn't they have it all set up? But the reality is the insurance carriers can choose to add more plans if they want to. And so if enrollments are not going the way they want, they may add, or vice versa. So our recommendation is the best time to start shopping is around December 1st. So get past Thanksgiving, get into that first week of the last week of November, first week of December. That's probably the best time to start shopping, and let me tell you why. There'll be the most options available during that time, and then you'll be able to compare, and you still have plenty of time to select your plan before December 15th. So I would target around December 1. Don't stress. You got plenty of time to look at it, and you've got other resources. So let's talk about the most common questions that we're getting right now that are coming through our call center. Our friends are all asking, hey, I'm a business owner, but I don't have many staff. Let's say I'm 8 to 10. Should I get a group plan, or should I think about the private exchange options? So let me just share with you. To buy a group plan, there are some assumptions you need to know. If you've never bought a group plan for your staff, let's talk through that. Group plans are great. I would say yes, if you can afford it, you should offer it to your team, okay? What typically happens, though, is that you're thinking, oh, well, I can afford my health insurance, but typically health insurance carriers require a minimum number of employees to participate. That's one. And then secondly, they also require the employer to contribute at least 50% of the premium. That's a requirement typically. And so what happens is now the economics change. You have to have so many people choose to participate, and you have to cover at least a certain dollar amount. And so what most people think, well, geez, if I have a group plan, I'll get better rates, right? Well, not always. The things that are benefit to group plans are these. Your employees can deduct as a pre-tax premium. That helps them lower their taxable income. That means that they're paying less in taxes. They're withholding less from taxes using the Cafeteria 125 pre-tax. So it's a wonderful thing for employees to take advantage of it. And so that's a benefit of getting a group plan, because on an individual plan, you can't take that pre-tax. There's a way, but it's a little bit more complicated. Also, the employer can contribute more than 50% if they choose to, and those are related business expenses. So if you have the funds and you're willing to want to pay more as an incentive or part of your benefit package to your employees, then you can as an employer. So that's a benefit. And then also, what's the advantage to a group plan is that you have more options than the marketplace. You get to pick a lot of different insurance plans to mix and match that meets your needs for your staff. So typically, that's a benefit to you. So you don't always have to have a certain high deductible plan, or you could go at a Cadillac plan, or a premium platinum plan. But just remember, if you're under 50 full-time equivalent employees, your prices don't change if you have 10 people, 30 people, or 45 if you're buying community-rated plans, which are typically what people purchase on group plans. They're all priced the same. It doesn't matter about the ages. It doesn't matter about your past history. It's all priced as a community. And so therefore, when you go to a different broker and a different broker, the brokers are going to be offering the exact same prices, just so you're aware, for those smaller plans. When you exceed that certain number, over 50, and depending on certain states, it may be 100, but that's when your prices may change based on your actual history of your employees, your age, and the makeup from genders and so on. And all those things matter when you get larger, and those premiums will be based on that. So I'm hoping this has helped people navigate this, but group plans are great if you can afford it. If you can't afford it, let's talk about the next option. And what I mean can't afford it, maybe not today, but maybe in the future you would like to think about it. And the beauty of that is you can add a group plan, and you could get off an individual plan anytime you want if you offer a group insurance plan. So you don't have to follow the open enrollment periods for a group health insurance plan, and that's a benefit. So you could do it when it is affordable, and maybe it's in 6 months, and then your plan starts on July 1st. So that's up to you. But if that isn't your option, you're a smaller staff, and this is what we tell a lot of companies. If you're under 50, I would definitely question why you're offering group insurance. If it's purely financial, I would say I think there's some other alternatives for you, and that is encouraging your employees to go to the individual markets to buy health insurance. And let me explain why. So what are the benefits to individual plans, meaning the marketplaces, or like the enhanced care marketplace? We have a marketplace for private as well as the government plans. And the beauty of our system is that you could compare them side by side. So you're not just driven by what the government wants to share with you. You have other alternative private plans that individuals can purchase. But here's the benefit. If you're eligible, meaning your income is at a certain level, you may be eligible to receive a federal subsidy. That means the government says, hey, your income level is at a point that we are going to assist you in covering some of the costs of your premiums, your health insurance premiums. And if so, we've seen some that, let's say a family of 4 or 5, and your income, your combined family income is around $90,000, which seems decent, which it is. You may still be eligible for a small portion of a federal subsidy to cover some of your premiums. I had a friend who was making in that range, had 4 or 5 members in his family, and he didn't realize that. He thought he made too much money as a family, so he didn't even check if he could receive a federal subsidy. So he bought an individual personal plan. And then when he went to the marketplace, realized, oh my gosh, I could have qualified for a federal subsidy to cover about $200 of that premium every month, but he couldn't because he already bought the plan. So just remember, you want to make sure you do your homework in advance. Make sure you've checked, okay? So here's the thing. You as a group, let's say you have 8 employees. Maybe some of your employees qualify to receive a federal subsidy. So that might be a good thing to move everyone to an individual plan, so they have to purchase a plan that way. When you're smaller, you can make that choice. The marketplace insurance premiums, here's the thing. There's traditional plans from those, like only co-pays to high deductible plans. So this is what we encourage people to think about. This is the difference. Most people don't really think about health insurance premiums. So health insurance premiums, the higher expense premiums versus the lower premiums, which typically have something to do with the deductible. So if your deductible is higher, meaning that you have to pay money first before insurance kicks in, that's what we typically call high deductible plans, but your premium is typically lower. What happens is that most people say, geez, that's bad. Well, not necessarily. Let me share with you that if you are a healthy family or a healthy individual, you don't use healthcare a lot, why are you paying a lot more in premium? Because you'll never get that money back. The premium is the premium. You're going to have to pay that every month. So we always encourage people, especially that have our enhanced care services, it's to go and buy our package, pick pick the highest deductible plan, lowest premium plan, and use our services to offset that when you do need care. Because then you'll never hit your deductible and you'll never have to worry about. But you have health insurance there just in case if there is a catastrophe or an accident or something that does happen, then you're at least covered and you won't be negatively impacted. But anyway, that's something to consider, and we find that after educating people, because I've had friends that said, I haven't gone to the doctor in 10 years, and then I asked them, what kind of health insurance plan? Oh, I got the best one. I only have to pay $10 for co-pays. And I said, but you're paying the most in premium. If you've never gone to the doctors, you've never used it. So you're probably better off buying a high deductible plan if you're healthy like you are, and only pay when you have to, and you just saved a lot of money. And on average, it's about $200 to $300 if you make those adjustments per month. So multiply that by 12. That's a nice vacation, right? Anyway, so think about individual plans. Not a bad thing. Make sure that makes sense for you. Typically check everything. Now, there is an option that I was mentioning, this third bullet. Not able to pay premiums pre-tax is typically what happens with individual plans, but a company can offer a health HRA plan, which is actually, I meant to say an HSA. No, it's a health reimbursement account. That's what I meant to say, HRA. You could purchase an HRA plan for your group, which allows you to allow your employees to do a pre-tax deduction for their premium payments for individual health insurance. But with that, there is a cost to that. It doesn't give them actual insurance. It just gives them the mechanism to be able to do that. And depending on the size, we typically say 10 to 12, 10 or more employees, it makes sense to do the HRA plan, so that you could say, hey, I'm willing to give you $200 towards your premium plus this HRA, so it allows them to reduce their premiums. But it's a nice alternative to offer something to your employees while going to the marketplace to be able to do that. And so we could obviously talk to you about those options if that's something and you fall into that group. But if you're smaller than 10, typically the cost of creating that HRA doesn't benefit you, and it's just better off for your employees to go to the marketplace. An alternative is to give them the Smarter Choices plan. Let's talk about that. So our members, and I want to watch my time, we got like 3 more minutes, and then we'll take some questions if it makes sense. But our Enhanced Care Smarter Choice program that we've designed for the marketplace and for organizations and individual families to purchase, it's a great opportunity to help you mitigate cost of care. And what we always start is that we give you access to a registered health coach, a registered nurse that is able to guide and help you decide what's the most appropriate level of care. And what I mean by that is, should you be going to the doctor? Should you be going to urgent care? Should you be going to the ER? And it's a quick phone phone call to a registered nurse who's going to be able to guide and give you recommendations. Many, almost a third of the time when people have called thinking they need to go to the ER, there is a self-remedy instead, because the truth is we don't know what's the best course of action typically. And we default to, gosh, we need the higher level care, and that doesn't always mean that. That means a lot more expense. If we could help manage that, we certainly want to help you. So you've got access to our nurses 24/7, 365 days a year. You can ask them multiple times a day if you wanted to about health-related topics. But let's say the nurse said, you know what, this does sound like an infection, that it's bacterial and you're going to need a prescription. So now we can connect you. You could go to your primary care physician on your own, pay your premium, that, or the copay, or the actual deductible amount, or you could use our doctors using a smartphone, a tablet, or a computer, or basic phone, and then our doctors will guide you and if necessary, write your prescription for that bacterial infection, from urinary tract to sinus to flu to common colds, the bee stings, and so on. Great option. The cost to you is zero versus if you went to urgent care, you're paying $85 to $125. If you go to your doctor, you're paying anywhere from $125 to $200. If you go to the ER, it's a lot more. We're talking $1,200. So this is a great option, and they're available 24/7, 365 days a year from the convenience of your bedroom, your house, your place of work. So it really does work. We just talked about the different things that you could use, but from skin, allergies, upset stomach, so on and so forth. There's a lot of options that our doctors can help you with. We also add in our plan dental, vision, and hearing, because health insurance does not include dental, vision, or hearing coverage. You have to pay that extra. Well, we include one of our networks of a large amount of dentists, vision care facilities, hearing aid places, and we find that we have pre-negotiated rates on typical dental visits, checkups, cleanings, and so on, all the way up to orthodontial and surgery. With our program, you get pre-negotiated rates to be able to get these benefits. And we find that many times this is much better than a typical dental or vision insurance plan. Now, I'm not saying eliminate that, but if you're just doing routine cleanings, you're paying too much in dental insurance if you do that. But if you do have some issues that may come up, then dental insurance makes sense, because there's a threshold of how much they're going to pay, right? It's either $1,000 per year, but you got to look at how much you're paying in your premiums. And so we offer this program that really works. We have so many great testimonials. We use it. I have daughters. We use the contacts. It works out really well. We also have a prescription savings program that if you are not shopping your prescription plans today, you should. What we do is we have an online locator and drug price using our prescription program, and you plug it in. You start to look at which pharmacy makes the most sense for you. And I tell you, I use this with my family all the time, and it changes from CVS to Walgreens to your local pharmacy. It all depends on who wants to bring traffic into you. Okay, so use this to help you, but you have to get the program. One other thing is alternative medicine. We look at mind, body, spirit, emotional well-being, spiritual. It's more than just the physical medical side. We feel that, geez, if we can help you, give you alternative ways to look at it, managing stress, better sleeping, having more peaceful, more holistic, we're educating you for alternatives. And this is one of the fastest growing areas of our program. So here's the marketplace. This is what you get when you get our program. You get all those services that are going to help you manage your health and need, but now because of open enrollment, you can search online, and the beauty of that is you can compare products, public as well as private plans, side by side, looking at the details of the health plans, along as with the premiums as well as total out of pocket. It's a great opportunity to compare. We also offer dental insurance, vision insurance, and other products, because we know people will want that, but we can help you as well, and there's some great plans out there. So I just want to say thank you so much for to ASID for allowing us to come and talk to your members, and hopefully we have, I hope I've helped you understand the difference between individual plans and group plans. We really do believe, our whole structure, why we created this company, was to help families have better outcomes, have affordable solutions, make it easy to get to, and also help people find those marketplace insurance plans much better than what they're used to. So anyway, we always focus on the value. Save time, save money on your cost, and try to mitigate what you're doing. So thank you guys for having us here. So I'm going to open it up for questions, and we can look at if there are, and if not, we can talk about some really popular questions that are coming through. Cecilia, are you with us right now? I'm not sure if she was able to join us.
David, it looks like she has joined us, but she has her phone on mute right now. But
Okay.
I would take this opportunity to thank you for giving us some clarity in what sometimes, and for a lot of people, is a really difficult health insurance landscape to navigate. So thank you very much for being with us today. I appreciate it. It looks like
You're so
Cecilia
welcome.
is now able to join the conversation. Hi,
Yes,
Cecilia.
hi. I'm sorry. I didn't realize I had it on mute. I was just saying good afternoon to everyone, and yes, I am here to answer any questions that anyone may have. And I have had the very good pleasure of talking to just a number of ASID members, individuals, small companies, larger companies across the nation, and able to get them some assistance and some help. So I'm here to do the same for those who are on the line as well.
Well, I want to thank you, Cecilia, for helping us. One of the things is when clients, ASID members are logging into Enhanced Care to learn a little bit more about our program, what they typically, Cecilia has a huge knowledge base when it comes to healthcare, but also from a human resource standpoint. And we found that working with Cecilia and her team really makes a lot of sense. And so first of all, Cecilia, thank you so much for your help and your knowledge and your ability to give. So let's talk about some of the most common, because you've been talking with the members directly, and isn't it about group plans versus individual plans? Isn't that the most prevalent question that's coming through?
It is. It is about group plans and whether this is a group plan. And I think, David, you've done a really good job of explaining what enhanced care is and the access that it gives the ASID members and their families to group plans and to the marketplace, and then just helping them navigate and understand. It's a really complex world, this healthcare right now. But again, we've been able to help companies with a group. I just sent out a census about 5 minutes ago to someone, and also those who have individual plans. We've talked to members who are on cooperative plans, and we've been able to get them into the marketplace and help them understand the enhanced care plan. And by the way, the enhanced care plan is available immediately. You sign up today, you get your member card, your summary of benefits, and access for your entire household in 24 hours, so in real time. And so we do have some very good, I guess I can call them case scenarios with ASID members, and some good success as well. And so again, we're here to help in any way that we can, whether it is assisting with a group plan or with an individual plan, and just helping you navigate and choose that right customized plan for your family.
And something I want to add is, because especially here in the state of New York, this is where I reside, and I know where everybody's from all different parts of the country, but right now the advertisements that are coming from the insurance plans that are advertising on television, they're talking about their telemedicine solution. It's funny because they never used to, and which is wonderful because it brings a little bit more focus on, wow, having that ability to make a call or a video conference using my smartphone from the convenience of my house, because typically when you get sick is not when your doctor's offices are available. And the reason why I'm bringing this up is this: many of the insurance plans or insurance programs across the country have a component of telemedicine. And what I want to share with you is the difference. So they are offering you a solution for off-hour times to contact them. the copay or their normal cost of the program, because they're an insurance company, they have to pay the the doctor the same cost as if you physically came to the doctor's office. So if you have a high deductible plan and you have to meet that $2,000, $3,000 deductible first, and you use your insurance plan's telemedicine network, you're going to be paying a copay or the full amount of that doctor visit, which could be $50 to $100. So the difference is, with our enhanced care services, we're offering you copays at zero. So there is no cost for you to use this for your family, other than the membership fee that you have. And the beauty of that is we've combined those services to help you not just navigate with a doctor, because most people think, oh, I need the doctor, right, Cecilia? Isn't that the most common? Everyone says, well, I want the doctor to write a prescription. But majority of the time, talking with our registered nurses first makes the most sense, because we find that the doctor is not going to be writing a prescription for everything. When you think it's like, oh, I need a prescription because I'm really sick, well, it's a viral infection, and what that means is you need rest, water, and certain over-the-counter drugs to help you navigate that. But anyway, I just wanted to share the differences, because I know we get that as a common question. Well, now with telemedicine programs within the insurance, why would I want to use this? Well, the beauty is it's 24/7, 360. Your copay is zero. You get nurses, you get doctors. You also get our prescription savings program, because remember, with a high deductible plan, you first have to meet your deductible before any help from the insurance side. So what that means is you're going to buy your prescriptions at full rates or at the negotiated rate, but it's still higher than it should be. And that's why you should be looking at purchasing the prescriptions at the right place. Cecilia, you have some great experiences of that, and I know we're getting close to our time. Do you have anything else? And I'll stop talking.
Sure. So with regard to what David's sharing about the prescriptions, I have been very successful at getting not just my own prescriptions filled. There is a portal, and you can go and you can shop and get the best deals. But I also have had the benefit of getting the prescriptions filled for my pets, for my dogs. So there was a prescription that my dog was taking, and we were paying quite a bit of money for that monthly, and then I discovered that I could use the enhanced care prescription benefits through Walmart, and was able to save about $60 a month on that prescription. I've also used the enhanced care for vision. So even if you have a standalone vision plan or you have access to vision care, I was able to use it at Sterling Optical to get an additional $70 off my frames for my eyeglasses. So there's x-rays, lab work, and all kinds of holistic care, the prescription portal. So there's a number of added benefits you get by using the enhanced care smarter choices alongside your essential, Affordable Care Act coverage that's required.
And Cecilia, it's so funny when you said it, it brings thoughts of how I've used it and other members. And Lori, you're probably thinking, geez, these guys, we definitely use our own program. We have used it forever. And I'm probably one of the highest users, because I know how to use it, and we want to educate you. And that's one thing that we do. We really try. We're passionate about our members getting the most out of their program. Our average members are saving around $1,200 a year on their healthcare services. And that's from, calling our nurses instead of going to the urgent care or the ER. It's using our doctor network instead of going, and we're not trying to replace your primary care physician. We're trying to augment it, help it, make it so that it's convenient for you. The prescription is huge, because do you know the average family spending over $2,000 a year on prescription drugs? Well, if we could help take, like what just Cecilia shared, if we could shave off $60 a month, do the math. That's a lot of money that a family could use towards something else. Or think about all the savings you just did. What about if you put it towards a vacation that you wanted? That's even more fun. when someone walks away. And then with the marketplace, what we find is this: when you go and search for a health insurance plan through our portal, we didn't mention this, but I'll mention it now, is that you could do it all online, search and log in and purchase online. But if you needed to talk to someone, you needed to talk to a licensed health insurance broker to guide you through that. You have access to our team. During this open enrollment, it's 6 days a week, I think approximately 10 to 12 hours a day. They're there to answer some of the specific questions that maybe you didn't know. And that typically doesn't happen if you're buying health insurance on your own. So what the beauty of it is, when you have our program, you have access to that network throughout the 12 months that you have the program. So you'll see the benefit that you're going to be able to get from it. And it's always good to compare. And one of the things that I'll say, and I'll end it on this note, you may not choose to purchase your private insurance plan through us, which is okay. But if we can help educate you to say that the current plan that you are on makes more sense for you to keep, then we're happy about that. We want to guide you to make the right decisions. But we know that you're going to want to use our services throughout the next 12 months to help you manage your healthcare costs. Because when you get sick, you need to get to someone who can actually help you. Please don't go to WebMD, because when you go to WebMD, what does it always happen? Oh, you've got cancer, you're going to be dying or something. And I'm not mocking them, but the reality is you're better off calling a healthcare professional like one of our nurses when you're thinking about it, instead of allowing your mind to go off, geez, that lump on my neck, what is it? I always encourage anyone that says, I've got these ailments, make a call to our nurse. They'll be able to help and guide you through the next steps and give you confidence. So anyway, Lori, thank you for giving Cecilia and I an opportunity to talk to your members. We look forward to, if there's questions that come afterwards, please let us know, but we're happy to address that. And thank you again, and happy Thanksgiving, because we'll see you guys on the other side of that into December, and we'll talk about some other good stuff that I think will be relevant for you.
Great, and
yes,
thanks
thank
again,
you, Lori.
David, and thank you, Cecilia, and we'll look forward to hearing more from you in the next webinar. So thanks.
Super.
Happy Thanksgiving to both of you as well, and enjoy the rest of your day, and thank you to everyone joining us this afternoon.
Thanks, Lori.
Right, thank you.
Okay,
have
bye.
a good day. Bye.